everyone. Thank you for joining us for our live MDA Engage Adult Neuromuscular Care Seminar. My name is Mallory Williams, and I am one of the managers of the Family and Community Support Team at MDA. We appreciate you joining us, and we are glad to be able to share this important seminar with you. I want to thank all of our supporters at Genentech, as their support is greatly appreciated. We believe in the power of bringing our community together for opportunities to learn from specialists and having opportunities to connect with others. This event is part of a larger MDA Engage series with the disease-specific symposia, community education seminars, which we are hosting today, and community webinars as well. Here is the agenda I have for today. As you can see, we have a busy couple of hours filled with wonderful speakers. I now have the privilege to introduce our first speaker, Sarah Stoney. Sarah graduated from West Chester University with a Master of Social Work in 2014 after she received her bachelor's degree in the same discipline in 2006. She joined the Children's Hospital of Philadelphia's Division of Neurology in 2014. Prior to this, she worked in the emergency department of Penn Medicine's Chester County Hospital and as a family counselor at the Lincoln Center for Family and Youth. At Children's Hospital of Philadelphia, she assists patients and their families navigate the complex medical system, advocates with families in their schools and throughout the community, and provides ongoing support to patients and families in the neuromuscular, leukodystrophy, and multiple sclerosis communities. Thank you so much for joining us today, Sarah. I will hand it off to you now.
Thank you so much, Mallory. Thank you for that kind introduction, and thank you for having me. Thank you to the MDA for inviting me once again to talk about what I think is such an important topic, certainly when it comes to advocating for yourself or your loved one who have complex neuromuscular diagnoses. My name is Sarah Stoney. I am a social worker at Children's Hospital of Philadelphia. And as you may or may not know, at Children's Hospital of Philadelphia, we often treat patients with neuromuscular disorders into young adulthood and sometimes beyond. So we are certainly informed about how medical assistance barriers can cause such an interruption to care across the lifespan, which is why these types of conversations are so important. The more educated we all become on how we can help advocate for you and for yourself, we want to make sure that we're sharing that information. So thank you for joining us today. So my goals for today, first and foremost, is to make this this discussion as entertaining as possible. Unfortunately, sometimes talking about such a mundane topic as medical insurance can sometimes be really overwhelming and dull. So first and foremost, I hope that I can keep you engaged and really provide you with some information that's helpful. It's incredibly important that we today and then continue to create informed consumers. One of the main things that I'll say throughout the presentation today is that the information that we're sharing about medical insurance and how to advocate for yourself is not something that you can learn in school or something that you can take a class on. The healthcare system in America is extremely complex and is very difficult to navigate. And there's really no structured curriculum to where you can go to learn about this. So unfortunately, our patients with complex medical diagnoses and their family members are kind of thrown in and kind of learn by either experiencing barriers or doing their own homework. It's a lot to put on our patients and caregivers. So hopefully today we're helping provide some of that information to you. We're going to learn about the different types of insurance plans and what they include. We're also going to review some common healthcare terminology and go over some definitions that you may see on documents from your doctor's office or from your insurance company. We're going to discuss how to navigate some of those common roadblocks that you may experience, denials, appeals, peer-to-peers. Talk about how to navigate going through some of those experiences. We'll hopefully have time today to review Social Security benefits and how to work and save without losing those benefits, and then really take away those resources that are going to help you for future planning. So anytime I do a presentation or a talk on medical insurance, I find myself using this graphic. And I do so because I'm pretty sure when I myself experience a barrier to care for either myself personally or for one of my patients, the overwhelming feeling is very real. And I'm pretty sure that this is exactly what's going on inside of my head. I'm seeing a lot of different terms, everything's really jumbled together, and it can be extremely overwhelming to try to break down exactly what the next steps are. So I'm here to tell you that if you've had the same experience, you are not alone, and that we're going to try to break down some of those key points one by one. So why is this important? It's very important, and I ask you to ask yourself a few questions and to see how relevant this information will be to you today. Have you or someone you care for been denied for what is considered medically necessary care? Or have co-pays, deductibles, or other fees caused you a financial hardship? Or a follow-up question to that, have you needed equipment or perhaps things in your home that should be considered medically necessary but are not covered by your insurance plan? I'm immediately thought of things like stair glides or ramps into your home. Have you experienced those types of barriers? Or have you even avoided calling your insurance company simply because you aren't quite sure what to ask and it's such a daunting task? And I am the first one to admit that oftentimes when I'm calling an insurance company, either for myself or for someone that I'm working with, I usually have to make sure I have a solid 20 minutes set aside because I understand there's going to be hold times. I might get rerouted to different departments that aren't necessarily who I'm intended to speaking with. So the entire process can take a long time and actually make someone want to avoid it altogether. So if you've answered yes to any of those questions, you're in the right spot, and we're not going to solve all those problems today, but again, hopefully just help with knowing where to go for some advocacy and provide some information. So knowing about your insurance and knowing about insurance in general matters a lot. And when we say matters a lot, that actually equates oftentimes to dollar signs. Insurance literacy is very important, as said by Ben Hendel, an assistant professor of economics at University of California at Berkeley. He's said people who have less information end up losing quite a bit of money, and that sometimes is equated into thousands of dollars. Nearly 3/4 of insurance buying public fall into what we call the illiterate category. In ongoing research by an assistant professor of economics at Carnegie Mellon and his colleagues said approximately 71% of people surveyed couldn't define basic cost-saving features of healthcare plan, including terms such as deductible, copay, coinsurance, and out-of-pocket max. Not having that information or not knowing some of those basic things can end up costing you a lot of money in the long run. And we're going to talk a little bit more about that later on in the presentation. So we start, of course, with the basics, which is that knowing your own health information is by far the most important thing. And what I say by that is that not just understanding or knowing what your health condition is or what your health condition requires, but also being knowledgeable about what is actually going on in your healthcare plan. If you go to the doctor, what tests are they running? What procedures are they doing? Because having this information will eliminate surprises on medical bills or co-pays that you may be requested to pay. So knowing your own health information and as much as you can know about it is really the best and first place to start. Additionally, I would add that you really want to know your healthcare team and understand what their role is. Being that insurance can be most complicated, I would advise individuals to talk to their healthcare teams as to who on the healthcare team can help with insurance, who can be a liaison, if possible, with the insurance company to talk about benefits, eligibility, and plans that are covered in order to ensure that those services that the healthcare provider is requesting will be covered as much as possible. Additionally, many healthcare providers also have people on their staff whom they typically call financial counselors, or they may have other titles. And those financial counselors often too can project to you or provide you with a potential out-of-pocket cost for many of the services that your healthcare provider may be asking you to have done. So again, knowing who those people are on the team is very important. If there are people employed and enlisted to help do some of that advocacy work for you, we want to make sure that that's available and known to you. You should also have as much access to your medical records as possible. Many institutions have online portals, even apps or websites where you can log in and now see pretty much your full clinic note, test results, and a history of what's going on at the doctor. That's really important to have access to. Again, knowing what's going on at the doctor, what they're asking for, what test results are coming, are going to help eliminate some of those surprises. If an online portal is not available to you, try to organize your medical records in other ways, such as either creating a binder that can be organized, a USB drive or a CD, particularly if you're storing imaging, or even a Google Drive where you would be able to upload that information. And as I already mentioned, just knowing your plan really helps reduce the amount of surprises that you may receive when you're getting an explanation of benefits in the mail or a bill for services. So understanding the type of insurance plan that you have is also very important. So we can kind of summarize those into three basic categories. The first being commercial insurance, which is typically obtained through a healthcare provider or through an employer. And most commercial insurance providers are for-profit companies, although some operate as nonprofit organizations. So those policyholders typically pay monthly premiums to fund those commercial policies. Their premiums and coverage amounts are designed to create a profit for the insurance company. Employer-provided healthcare group policies are considered commercial, as are individual policies that you can buy if you do not receive employer or government insurance benefits. So if insurance is not available to you through your employer, you can go to a healthcare company and purchase an out-of-pocket plan. Additionally, the Affordable Care Act has also made this process a little more streamlined by going through the website healthcare.gov, where individuals can submit their medical information, their financial information, and then be linked up with a plan that financially best suits them. So that is many of the plans available at healthcare.gov are also considered commercial. Medicaid, or medical assistance, is a joint federal and state program that, together with CHIP, which stands for Children's Health Insurance Program, provides health coverage to over 72.5 million Americans. This includes children, pregnant women, parents, and seniors and individuals with disability. Medicaid, or medical assistance, like many other plans, can also sit as a secondary insurance to many primary insurance insurance plans. Why this is so important to have Medicaid, if you're eligible, as a secondary insurance, is that Medicaid will often help cover costs that your primary insurance doesn't pick up, such as co-pays, deductibles, or co-insurances. So in the long run, can be very cost effective. Medicaid Medicaid is also the single largest source of healthcare coverage in the United States. And lastly, there's Medicare. Medicare is a federal program, a federal insurance program for a group of individuals, including those who are over the age of 65 and certain younger people who have disabilities. There's 4 parts of Medicare that cover very specific services, Part A through Part D. Part A covers facility, hospitalization, or placement. Part B covers physician services, such as a doctor's bill for their actual services. Part C is Medicare Advantage plans, and D is prescription drug coverage. And again, many of the insurances we just talked about can be congruent. Oftentimes you can have Medicare as a primary with Medicaid as a secondary, and you can make that combination with almost all of these plans. Typically, whatever insurance you've had longer will sit as the primary insurance. So now we're going to review some healthcare terminology, just simple, basic terminology that you may or may not have heard of, such as the following. Your premium, that would be the cost that you pay for your health insurance every month. This is in addition to other costs that you have. So this is outside of the costs related to deductibles, co-insurances, or co-payments. Deductibles is the amount that you pay for covered healthcare services before your insurance plan actually starts to pay. So you may have X amount of dollars deductible that you have to pay out of pocket before your benefits actually kick in. There's HMOs versus PPOs. HMO is a type of health insurance plan that usually limits coverage to a specific group of physicians that are in contract with that insurance. A PPO is a type of plan that contracts with medical doctors, but also has a network of out-of-network doctors that you can work with. Co-insurance is the amount paid after the deductible has been paid. Typically, this is a flat percentage. And co-pays are amounts paid on same day of service. Secondary insurance, we talked about a little bit earlier. That supplements your primary insurance plan and can be either a commercial product or a Medicaid product if eligible. A prior authorization is a decision that is made by the health insurer or plan that a healthcare service is in fact medically necessary. And just like the term itself, this has to happen prior to the actual execution of the service, whether it be a doctor's appointment, a medication, or a procedure. Pharmacy benefits are just the part of the plan that help pay for prescription drugs or medications. This is important to know specifically if you have medications that come from a variety of different sources. And what I mean by that is that not all medications you can pick up just at your local pharmacy. You may have some prescriptions that have to come from specialty pharmacies or compound pharmacies. So knowing specifically your pharmacy benefit and what it covers on the different types of pharmacies where your medications may need to come from is really important to know. That's the term you would use. And your vision benefit purely covers your vision care like eye exams and glasses. Your behavioral benefit, similarly to your vision benefit, is also another separate provider than your medical carrier. This separate, and the reason why it's important to know that it's separate is that oftentimes it's actually the name of that behavioral health benefit company or a managed company that you would need to know in order to seek services or to know whether or not you're a mental health professional is in network with your insurance. A pre-existing condition is any chronic disease, disability, or condition that you have at time of application. Waiting period is just the waiting period that oftentimes employees sometimes have before you can enroll in insurance plans. If you find yourself in a situation where you're not eligible for employee benefits, you can always enroll in either a COBRA plan or in a commercial plan temporarily through healthcare.gov until your benefits kick in. Enrollment period or open enrollment is that window of time when you can apply for health insurance through your employer. This can also happen if you have any type of life event change. So if your employer has open enrollment every May, but you get married in October and want to have your spouse join your insurance plan, that's of course okay because you had a life event where you needed to make a change to your insurance. Okay. So a question that I get asked a lot is, which insurance should I choose, or which insurance is best? Which insurance is best is one of my favorite questions to answer because, quite frankly, I think that there are flaws in nearly every insurance plan that exists. Our healthcare system is just really complex, and while it's nearly impossible to say that, well, while one insurance plan may really excel at some benefits, they might actually not be great in other areas. So you have to figure out what plan is going to work for you and your family. So some questions to ask to ensure that you're looking at all the options. Do you fit the requirements, first and foremost, of one of the government insurance providers? So do you meet the financial criteria or the medical criteria to actually get medical insurance through your state or through federal Medicaid? If so, that of course is an excellent and cost-effective option. What specifically are your healthcare needs? So for every person, that's going to look a little different. So your medical diagnosis could require a significant amount of specialty prescriptions, but not really require a significant amount of home care. So that may actually change how you're looking at insurance options for yourself or for a family member. What's important to you? Is it important that you save on costs and have and are more limited by the types of physicians that you see? Or do you want to pay more each month and have more flexibility on which physicians you see? What is that importance to you when it comes to that level of flexibility? How important is that monthly payment versus how much you pay when you go to the doctor? How much is your out-of-pocket costs? What are you most, how significant is paying a large out-of-pocket to you, and how much of a financial burden will that be? And how does the plan cover medications that you are currently taking? Very important for many of our adults with neuromuscular conditions. So what supports exist for adults with disabilities? And we are often working with our young adults on this at Children's Hospital of Philadelphia. Once our patients turn 18, a lot changes for them. So Social Security benefits that may have previously been denied, because when you apply for Social Security prior to the age of 18, your parents' income is taken into consideration. That, of course, changes at age 18. So this is something that all adults with neuromuscular disease over the age of 18 can and should apply for. So Social Security we'll actually talk about in one moment. There's another access to services and insurance that is likely available in almost all states, and those are called waivers. Waivers, they have different terms in nearly every state, but they're also known as Medicaid home and community-based waivers. You can do simple searches through the Office of Disabilities or even with vocational rehabilitation organizations in your state to find out whether or not there are waiver programs that you are eligible for in your specific state. So the reason why waivers can be so important is that they can be opportunities for patients to obtain medical assistance or Medicaid regardless of their financial income, which is of course really helpful and important to have as a secondary insurance. But what's also great about waivers is actually comes from the term itself. So the term waiver comes from the government's acknowledgement that these programs quite literally waive the restrictions of insurance, of medical assistance and Medicare rules. So for example, many waiver programs, I'm thinking of the one in Philadelphia in Pennsylvania, over the age of 18 or 21, you can be eligible for what's called a Community Health Choices waiver program. In New Jersey, it's called MLTSS, barring specific medical criteria. And in those waiver programs, there's access to other things other than just Medicaid itself. So there's typically access to funding for home modifications or vehicle modifications or services that are not typically covered inside a medical plan. So always important and really helpful to know whether or not there's a waiver program in your state that you would be eligible for. There are other specific healthcare accounts. I have to tell you, when I first started doing talks on insurance, it took me a really long time to understand the differences between these two. But you may understand from your employer or even independently that you have an opportunity to save for either a flexible savings account or a health savings account, known respectively as an FSA or an HSA. The reason why these are important is that they can help cover healthcare costs that are out of pocket to you, such as co-pays, co-insurances, and those types of things. An FSA is established by an employer. It's usually funded by pre-tax payroll deduction, but employers can also contribute or match. It can be used in conjunction with any type of health insurance, although health insurance coverage is actually not required. So you can have an FSA without having health insurance through your employer. FSA funds can be used to cover deductibles, co-pays, co-insurances, as we said, as well as other qualified medical expenses that are not covered by your health insurance. One example that I'm thinking of that many of our patients use it for are treatments such as acupuncture or other integrative medicine options that maybe do not have a benefit that exists in their health insurance plan. This money that is not used by the end of the year must be forfeited. So it's important to note that, because if you're putting a specific amount of money into an FSA every year, you want to make sure that that money is going to be used so that you are not losing any money at the end of the year. So if you have to get a specific number, if you have a specific number of testing that needs to be done or lab work that needs to be done, try to do a rough estimate in your head when planning how much to put into an FSA so that you don't lose money at the end of the year if it's not used. An HSA can be established by an employer or by an individual, but this can only happen in conjunction with an HSA qualified high deductible health insurance plan. Contributions can only be made while the account holder remains covered by that high deductible health care plan. Money can be used without being taxed for qualified expenses at any time, even if that person is no longer covered by that high deductible plan. Money in the HSA that is not used for medical expenses do remain in the account, so they can carry over from year to year. Okay, so cracks in the system, and this kind of goes back to the discussion we were having before about insurance literacy and how not having that literacy or that knowledge about basics in the insurance world can equate to dollar signs. So here are some statistics. Over 43 million people have medical debt. It's a really astonishing statistic. And despite, I think, of false information, medical debt can in fact damage your overall score. Outstanding medical bills can go to creditors and can be reported to the credit bureau. More astonishing, nearly 80% of medical bills contain errors. I'm going to say that again because it's so important. 80% of medical bills can contain errors, which is why when you're receiving information from your health insurance company and you are comparing it against what you have or have not had done at the doctor's office or labs that you've had, it's really important to know whether or not the charges that you're receiving actually equate to what has been billed. I can't tell you enough how many times I get calls from either parents or patients themselves who've received bills, and it is such a simple fix of something not getting coded right or something not getting submitted to the insurance correctly, and is nearly resolved 100% of the time. This is not fair that you have to invest so much more time into overseeing a system that should already be working, but at the end of the day, it's really about ensuring that you have access to the information you need in order to advocate for yourself. So many times requests to the insurance companies are denied simply due to preventable errors. Again, a very, very common thing that we experience at Children's Hospital of Philadelphia. If insurance company misdates a procedure or they don't acknowledge a prior authorization when it was submitted on time, those very, very simple clerical errors can cause denials and a lot of paperwork and follow-up, both on yourself and for the healthcare provider. So major flaws in our healthcare system. So navigating insurance barriers, you may have heard these terms in the past, an appeal, a peer-to-peer, a grievance. Again, all very time-consuming tasks for our patients in the neuromuscular community. But you may experience that there is a healthcare test or piece of equipment or something that is denied for one reason or another. You can appeal that decision, which is just a request to your health insurance company to review that decision if it denies the benefit or payment. You can ask to see if you can get a peer-to-peer completed by the ordering physician. We do these all of the time at CHOP. This is usually there's usually a designated period of time after this decision has been made when that requesting physician can speak directly with the physician from the insurance company. Again, super effective and typically can help overturn a denial very quickly. So if there's an option for that, having a doc-to-doc conversation about what is needed and why, often very helpful. And then a grievance is a formal complaint that you communicate to your healthcare insurer or plan. Grievances are typically all done in writing and oftentimes help escalate a denial or situation. So what else we can do? You want to, of course, be proactive and ask questions. So prior to your medical appointment or medical procedure, ask as many questions as possible. Ask about if you go into the doctor's office, then they want to make sure that you have a specific test on that day. Ask questions about whether or not those types of procedures are covered and what the out-of-pocket cost can be. Try to do that proactively so that you can make the best financial decision for yourself. Inquire about payment plans and payment forgiveness. There are often several programs within every hospital enterprise that helps with payments. If it's just a payment plan, you can often have a zero interest payment plan where you make monthly payments for a large bill that you may have received, or also for payment forgiveness. I can tell you that the financial assistance program at Children's Hospital of Philadelphia casts a very, very large net in order to try to help capture patients. So when I am talking to patients and their families about applying for financial assistance, where their CHOP bills would help get forgiven, they oftentimes think, oh, I'm working or my spouse is working, we wouldn't qualify. And that's oftentimes not the case. At CHOP, I believe that it is 400 times the poverty level that is our cutoff for financial assistance, which is significant, and we do that on purpose so that we can help capture working families that may be eligible or really benefit from financial forgiveness. If you have a fee dispute with a hospital system, the local chapter of the American Medical Association will typically have a panel where you can file a fee dispute. And most importantly, talk to people in your community. There are often grants, nonprofit organizations, and a lot of financial resources and funding options through third-party organizations that can help cover the cost of medical bills or medical equipment. So who else can help with this? First, I'll advertise myself. Ask if your hospital institution has social workers or financial counselors that can help navigate some of this. Like we've said consistently, this is extremely confusing and complex. So the more hands that can help, the better. Insurance case managers are individuals at the insurance company. Oftentimes you can get a direct phone number for them, which is how I think they're the most helpful. And they understand your plan and aid in some of those authorizations and referrals. Typically they get to know either you or your partner's or your child's medical case very closely. So they understand your medical background. And so when you're calling the insurance company, you're already speaking with somebody who's very familiar with your medical condition and what your needs are. As I mentioned, financial counselors at your physician's office or hospital, all the PA Medicaid coverage of the Medicaid coverages have a department called a special needs unit. This is a unit that is manned specifically by social workers at the insurance company that answer the phone when you call and can help navigate. Waiver programs, of course, if you are eligible for a waiver program, you will typically get assigned a case manager or someone who oversees your case. And then most importantly, other families, because they've had similar experiences to you. We'll talk very briefly about Social Security. I know I'm running close on time, but Social Security income is a federal program that is for individuals who are of low income, who are either 65 or above, blind, or have a disability. These individuals are eligible if they have both a physical or mental illness, and of course neuromuscular diseases do typically fall for the most part in that category. Payments to individuals who are eligible are based on the federal benefit rate. Some states are increasing payout based on the cost of living in that specific area. So eligibility requirements include that the person cannot exceed the income cap. They must have that physical or mental condition severely limiting their activities, and the person's condition must last for at least 12 months, or the condition will result ultimately in death at some time. The renewal process typically takes place every 3 years. This occurs if you or your child's condition even if it will not improve, and if it's lifelong and it's non-curative. Regardless, during review periods, you must show proof, as in your original application, of not only the disability, but also your financial information. Applying for SSI has gotten, I will use this term, hopefully don't take it too lightly, but has gotten mildly easier in the last few years, in that at least starts with one centralized phone interview. So you don't have to go to the office initially and stand in a long line or try to speak with somebody in person. You can actually contact the Social Security Administration or apply online. Now, only individuals over the age of 18 can apply online right now. That is changing soon. So remember that Social Security is based on income. So if you qualify financially, they will send you additional information after that initial phone interview, and they will ask for that documentation in the mail. If your assets disqualify you, then they will let you know that you're not eligible and you don't have to go through the rest of the process. If you are disqualified by Social Security during the phone interview, still ask for a denial in writing. It's just important information to have. These are other options for saving while you're receiving government benefits. And I'll talk for a minute about my love of ABLE accounts. Before ABLE accounts, special needs trusts were typically what patients and families were using to protect money so that individuals could work or save while still receiving, sometimes Medicaid or Social Security. Special needs trusts, however, often got complicated complicated because they have to be managed by someone who is considered the trustee. What I appreciate about ABLE accounts is that they're really fantastic for our patients in the neuromuscular community because they are self-driven. So you yourself, as someone, as an adult living with neuromuscular disease, can completely control and transact in your ABLE account. ABLE literally, quite literally, stands for Achieving a Better Life Experience. They're tax advantage savings account for individuals. And the money, there are caps on how much you can put into an ABLE account and how much it can grow to over time, but those are very generous amounts, and it varies from state to state. So if you have not yet heard of ABLE accounts, my suggestion would be to go to a search browser and look into your state and type the word ABLE account to see what your state's program looks like. Many of our families in the neuromuscular community have taken advantage of this. So our most important takeaways from today, and I hope that I have stressed this enough, insurance is extremely complicated. There's no and ifs or buts about it. As I mentioned, there's no course for this in school. So it's really important that you ask as many questions as you need to. And if you're asking questions at your physician's office and they don't know the answers, ask them to be connected with somebody who can help. Try to stay informed. Try to keep paperwork that comes in from your insurance company. One of the terms we didn't have in our glossary in our presentation today was EOB, or exclamation of benefits. EOBs can oftentimes be confused for bills because it looks like you're getting something that has an out-of-pocket requirement on it. That's also a really helpful piece of information to keep with you because it's explaining what part of your benefits were covered and which weren't. So try to keep that information as much as possible and stay organized. Advocate, of course, for yourself and your loved one. Be creative when problem solving. Ask for questions about payment forgiveness or payment plans, and really enlist the help of your medical team, of course, but also other individuals in the community that can help. Specific to Pennsylvania, there is an organization called Pennsylvania Health Law Project, which dedicates their time to helping individuals understand their medical insurance. They're a phenomenal resource, and there's resources like that nearly in every state. So really talk to your medical team about who can help you. A huge thank you to everyone in my neuromuscular program that allow me to do the things that I do and our incredible neuromuscular families. And at this time, I think that we have some time for questions.
Yes, we certainly do. Thank you so much for your presentation, Sarah, and
Of course.
truly for serving as such a great advocate and resource for our community. So just to dive into some questions, we'll do so in a minute. But again, if you have any questions, please do type them into the Q&A bubble, and we will get through as many as we can here. So I think that I will start in the chat. Okay, we have a question pertaining to older adults like this participant with a neuromuscular disorder who will be entering Medicare, and what would be your best recommendation? Straight Medicare with a supplement or a managed Medicare?
So that's a good question. It really pertains to what your specific needs are. My first indication would be to specifically talk to your healthcare provider. Present the options to them so that they can go over what your specific medical needs are and how it will which one will greater benefit from you. Of course, there's parts of Medicare that you can't turn down that you have to enlist, but they may be familiar with which one is better suited for you, or even supplemental plans that are specifically good for our patients that do live with neuromuscular diagnoses.
Thank you for addressing that question. We have another pretty specific question, but an individual who is trying to Google waivers in the state of Arizona, and I think they're just struggling to have anything pull up related to insurance, and wondering if you have any Google search recommendations or any direct websites that might be more useful in navigating this.
So I do. I'm wondering if it may be easier, Mallory. I'm not sure if it's possible. So I'm thinking of one, and don't be confused by the title of the website, but there's one called Kids Waivers, so kids with an S, waivers with an S.org. It's not just for, many of the waivers that come up on that website are sometimes for kids, but also for adults. That is honestly a really reliable site where you can search by state for waivers that are available in your area. If you're finding that what you are locating on that site is more pediatric focused, then my next go-to reaction, and I can look too, would be to look into ask your local, in Pennsylvania, it's called OVR, but it's your Office of Vocational Rehabilitation. That is called something different in every state. In New Jersey, it's called DVRS. I'm not sure what it's called in Arizona, but that's the organization that would typically help an individual with supports or funding, ensuring that they can get to work or get to school or whatever their daily routine is. So they would likely know what funding sources would be available. Mallory, if it's okay with you, I can check some of my other sources that I didn't name today and get back to you if you can get that person's contact information.
Yeah, absolutely. I'd be happy to. And again, with any other very specific questions that we're unable to address today or don't have time to, please don't hesitate to reach out to our MDA Resource Center. Again, it will be at the end of this presentation, but Resource Center at mdausa.org, as we'll be happy to support as well. It looks like we have another question. Do you know why we have to go on to Medicare when we are SSDI unless we want to pay the penalty, when the former employer still covers you at employee rate and they now have to be your secondary insurance?
No, unfortunately, no. As we mentioned, and I think we can all agree, we have a really complex, frustrating healthcare system. As you can imagine, I have several physicians that I work with at CHOP that are from Canada that do not understand a lot of the restrictions and issues that we run into with the penalties and the requirements of enlisting one of those Medicaid plan or Medicare plans. I would recommend, even though it sounds like you've done your homework, just ask if you have a local financial counselor at your healthcare institution to see if they can walk it through with you to see if there is any other option for you. They likely would be the best ones, but the short answer is no, I'm sorry.
That is okay. Thank you very much. All right, I think that we have gotten through our questions. I'll just give it another minute, as we do have still a few more minutes, just in case anything else comes through. Are ABLE accounts considered assets when qualifying for Medicaid?
No. So no to some degree. So I can tell you, only because I know them off the top of my head, I can tell you the Pennsylvania requirements. The Pennsylvania requirements are actually a little more conservative than other states. So it's likely if you're living outside of Pennsylvania, these numbers could be a little bit higher. So the last time I reviewed Pennsylvania's requirements, in an ABLE account, and a Pennsylvania ABLE account, you can contribute up to $14,000 per year at a max cap of $100,000 before your Medicaid would be, before your Medicaid could be in jeopardy. And that number increases to $350,000 before Social Security could be affected. And now that I'm saying it, I'm worried I may have them backward. But PA ABLE by far has one of the best states. If you are messaging in from Pennsylvania, PA ABLE has an amazing eligibility brochure that very clearly states that. But there's two caps that you want to look for. One, and typically they're different. So one cap is how much overall savings you can accumulate before before Medicaid could become an issue. And then the overall cost that you can accumulate before Social Security would become an issue. And now that I'm saying it, I think I did maybe have them backwards in Pennsylvania. I think it's a $100,000 cap for Social Security and $350,000 cap for Medicare, or Medicaid, I'm so sorry, Medicaid. I believe those are the numbers in Pennsylvania the last time I looked. But again, they're going to be different in every single state. The other really interesting thing about ABLE accounts, which this is kind of a subset of ABLE accounts that I haven't quite figured out yet, but it's important to either talk to a financial advisor about this or with the ABLE program themselves. ABLE accounts are actually kind of competitive. So you actually don't need to reside in the state that you live in order to obtain an ABLE account in that state. So for example, I remember New Jersey's ABLE accounts didn't come out at first, and I was meeting patients and families that had Washington state ABLE accounts. It's like a really interesting facet. So you can actually shop around for ABLE accounts. You can look into different states' programs and determine which one really best fits your needs. I happen to know Pennsylvania the most because that's where I work, but those caps do exist, and they try to be generous so that people can save and still work. With Pennsylvania specifically, I wish the allowance of how much you can put in per year was higher, but like I said, other states may be more generous in that number because PA is kind of conservative. I hope I answered the question.
Yes, this is great information, Sarah, and thank you so much for all of these specifications as well.
Of course.
I think this does wrap up our time for Q&A, but again, please, participants, don't hesitate to reach out if you have additional questions. I will chat in the Resource Center email address and we can get back to you that way. But otherwise, Sarah, we sincerely appreciate your time and expertise and everything that you do for the community. So thank you for joining us.
Thank you so much to everyone spending their afternoon with us, and thank you, Mallory, again. I appreciate it.
Of course.